Welcome back to our program. I'm your host, Wu Ruiguo. In this segment, we will continue our conversation with the Honorable Ching-Chuan Yeh, Minister of Health of the Republic of China. Minister, we're going to talk about the most recent outbreak of influenza A. This is something, of course, according to World Health Organization, is being upgraded to near pandemic level.
It is pandemic.
It is pandemic now already.
6.
Okay.
Yeah,
and this is a serious threat, at least at the beginning, to a lot of people in Taiwan, especially after our very unpleasant experience with SARS back in 2003. What was your experience this time in terms of dealing with influenza A, H1N1 virus in Taiwan, as compared to earlier experiences, particularly in 2003 when you combated the disease of SARS?
Okay. At the beginning of April, Mexico, they had this
outbreak.
Flu.
Yes.
And they reported that the mortality rate will be 6% or 8%.
Very low.
So everybody is panic. It's just like SARS. SARS, the mortality rate is about 10%.
10%.
But when facts coming out, we actually CDC also, our CDC sent an observer to Mexico City and found out that they are underreported the ordinary cases.
Oh, really?
They only report the severe case. So the mortality turned out to be less than 1%. And but the virus is highly contagious. The infectability is very high. So now it's at the end of June. The virus already widespread to most of country in the world.
In the world, yes.
More than maybe 150 countries already have
reported cases.
Yeah, have reported cases. And but fortunately, the WHO found out the severity of this virus is moderate.
Yes.
In Mandarin, it will be 温和的.
Yes.
死亡率没那么高.
Yes.
That's the good side of the this influenza A H1N1 pandemic. But we are watching closely that the virus only a small change of the gene, the RNA, DNA.
Yes.
Would be drug resistant. Currently, we know how to how to
treat it.
How to diagnose it. How to test it. How to treat it. How to prevent it. How to vaccinate it.
Yes.
And the vaccine will come out by early September or early October. So it's not so terrible. We know more than SARS. The SARS, we don't have medicine. We don't know how to diagnose it. We have no medicine to treat it. No vaccine. The only way to deal with is public health measure. But this influenza A is not so terrible. But with the small mutation, it could be drug resistant.
Yeah, difficult.
Currently, we prepare about 10% of our population size, about 2.5 million doses of
vaccine.
Tamiflu. No, not the vaccine. Tamiflu.
But
the virus could change to a drug resistant virus, so we can only depend on vaccine. Currently, we will prepare 10 million doses, patient dose.
Yes.
We have 23 million population. We prepare 10 million for the total population. The first one will come out by September. By the end of December, we will prepare all the 10 million. So half of the population can be vaccinated.
Yes.
People like you don't have chance to vaccinate. We have reserved that for the medical personnel,
yes.
for the aged people, for students, for
younger children.
Yes. And if you infected, then you can take Tamiflu.
Yes.
Maybe you don't need any vaccination.
Fight it on my own. Yes.
You can recover on only a few days.
Yes.
That's what we are doing now to prepare. At the beginning, we to contain it away from Taiwan, but that's not possible.
No.
The purpose of the containment, just to buy some time so that we can prepare the vaccine and the medicine.
Yes. Yeah. So, Minister, we know that, as in the words of President Ma Ying-jeou, when the weather cools down, when the fall comes, this is really the real battle for this disease. And like you said earlier, with a single change in the DNA, this virus could be difficult, drug resistant, and also difficult to diagnose, and impossible maybe to treat it without a vaccine. And how would you then think, with the climate change in the fall season, that people in general can better prepare themselves, to shield themselves away from the attack of the virus?
The Taiwan is coming. The summer is coming, but for the southern hemisphere, winter is coming. So we have about 3 months to observe what the virus can do to the Australian, New Zealand, and Southern American, Southern African. What happened to them, and is the virus mutated, and how the Tamiflu and Resenza treat them? What's the efficacy? And the outcome of the vaccine, they will begin to show the population, and we can observe the result of that new vaccine. I think the Australian, they already have widespread infections. In Melbourne, the city maybe already, all the city are infected. Maybe, we don't know. They reported thousands of cases.
Really? That's very serious.
But that's the beginning only.
Only the beginning?
Yes. Only the beginning. Sydney, they're still quiet, but it could spread to Sydney, to Perth, to other cities. We have we already buy about 3 months to observe what happened in other countries. And of course, we have 3 months to prepare all the vaccine, and medicine, and see what happened. In summertime, the virus, because
it's not very active.
Every day the temperature is more than 30 Celsius.
Centigrade.
Centigrade. Then the virus will be inactivated when they come out of body.
Saliva.
They cannot survive
the heat.
So we'll wait and see what happens. But I believe we are one of the country. We are well prepared. Than most of the other countries.
And Minister, we understand that this is a very integrated global village that we're living today. And you cannot stop people from traveling from one country to another, whether it's for business or for pleasure. Given that background, then we had the experience, very unpleasant experience in 2003 with SARS. And now this year, 2009, we have the experience of influenza A. And we hope, of course, the disease can be effectively contained, and the virus will not, spread into a pandemic when the fall and winter seasons come. But what would you, as a leading expert on public health in Taiwan, tell our audience that what can we do to protect ourselves, just based on our own immunity system, and that we can shield ourselves from the spread of the virus by, for example, washing hands or exercise, not eating too much unhealthy foods. What would be your recommendation to ordinary people who want to protect themselves if the vaccine is not yet available?
Yeah. Most countries already give up to contain the virus. They already have a community widespread infection, but Taiwan we still have ability to contain that at border.
Yes.
But some maybe after September or October, we will change this policy to mitigation to ease the damage, to ease the problem of infection, to prevent disease, prevent mortality.
Yes,
that's our goal. But for personal hygiene, you can of course you can avoid to contact with those already ill, and if you are sick, you can use your handkerchief or
wear a mask
to prevent to
spread to
others.
Yes.
And wash hand and away from those crowded area. That's the personal protection. And of course, you can exercise. You can have balanced food, balanced diet, and have outdoor activities to have more sunshine.
To
protect yourself. Yes. But that's not. That's only the personal efforts.
Yes.
I think the government is doing the total solution. What we can do. Public health measure, the medication and vaccination, and of course the last thing will be hospitalization treatment.
Yes, so all of them together. Okay, good. And we're going to take a short break on Taiwan Outlook, and when we come back, we're going to tell you why 2009 is a very important year for Taiwan's international space, starting with our presence and participation at the World Health Assembly. We'll be back in 3 minutes.